ACE Podcast.
Hello everyone and welcome back to another very exciting episode of Vaguely Accurate. I'm your host DK and joining me on this episode is Vanesa. She is a physiotherapist from Argentina who has moved over to Australia to conduct research. She did a master's at Sydney and she's now doing a PhD which is funded by the Spinal Cord Injuries Australia or SCIA. And she's currently doing a PhD at Edith Cowan University or ECU. Honestly, having Vanesa on the show was very enlightening, and as a humble guest, she was fantastic to listen to. I learned so much about the life and experiences of those with spinal injuries, and also about the rehabilitation and the treatment opportunities available to them. Her research is looking into electrostimulation therapy and using it as a rehabilitation method, but I'm not going to tell you too much. Let's jump into the show in a minute, and she'll tell you everything. One thing before we do go in is I do want to give a shout out to ACE Podcast Network. Check them out. They got a huge array of shows on there for you to definitely check out. And also a new thing that they're starting to do is if you want to get into podcasting, especially for science communication, which is a fantastic tool, get in touch and we'll teach you and help you to make a difference. And also just get involved. Just get out there and tell your research. Share what knowledge you have. Someone's going to listen. Anyway. Good to see you guys, and let's enjoy the show.
Vanesa Bochkezanian, from Argentina. I'm a physiotherapist. I practice physiotherapist for over 10 years in Argentina. Mm-hmm. And after that, I went to Sydney, University of Sydney, and did my master's by research. And after that, I started my PhD here in Perth at ECU. And now I'm in my final stages.
So what made you transition from being clinical to going into research?
Okay, so I got to a point where I was working and I was, when you're on a routine kind of work, and I wasn't enjoying it. And my personality is more like I really want challenges, and I want to be always motivated to do new things and being always challenged, and I wasn't being challenged at my current work, so I was looking for something different. I always wanted to live abroad, so I was always fascinated by English. I did 10 years of English school outside.
Yeah, your fluency is fantastic.
Thank you. I think being here helps me a lot. But I always wanted to have that experience, and I started looking for it. I was, if you're bored and you're not really where you want to be, you just need to look for other opportunities. It's not going to come to your door, so you have to go after them. So I started looking for different avenues, and I initially wanted to go to the States, so I started all the process to get my registration in the States, which is incredibly difficult. So I found it.
We'll avoid the topic of visas right now.
Yes,
I'm
exactly.
going through that at the moment.
So I, after like a year and a lot of money and endless English tests, which told me that I wasn't fluent in English. So I had to get a score of 26 out of 30, and they always give me, I took like 3 tests, the TOEFL test, it's called the TOEFL test, and I always got 24. Oh. So it's 24. I was like, seriously? You gotta be kidding me.
If it makes you feel any better, I've heard of stories of English speakers from their home
failing.
Failing.
I know.
I have no idea on what their level of expectations are.
I don't know. You have to speak to a computer. So basically you have to speak in 1 minute and have an introduction.
So it's only like a minute long?
Yeah, 1 minute.
Oh, wow.
So you have to, in 1 minute, let's say, who was your favorite teacher at school? Give reasons and examples to support your answer. So you have to 1 minute
so it's pretty much a minute of the email security questions you get given.
Exactly.
Fantastic.
So anyways, that didn't work. So I started looking for other check other opportunities. So there was this kind of workshop about Australian University. So I went there and I said, well, maybe if I need to start studying again, or doing a master's, or doing something a part of my undergrad degree. And well, there were some opportunities to do masters and PhDs, but you can't do a PhD if you don't have a master's, and my level was just undergrad at the moment. So so I applied for I applied at different universities. I got rejected by a few, but but at University of Sydney, I got in contact with this professor who was specializing in exercising people with spinal cord injuries, so people in a wheelchair.
Yeah.
So I was very interested in that because I have been working for more than 6 years in the neuro rehab area, and I was mainly working with stroke and spinal cord injury people.
Your prior work, was it hospital based?
It was in a clinic, It was a rehab clinic, a private clinic, and it was very intensive exercise, and so it was like interdisciplinary. You have speech pathology, occupational therapists, physical therapy, the doctors. Kind of like the allied health hub. Exactly, yeah. So I enjoyed, like, the first years. I enjoyed very much. I learned a lot. Most of the background that I have in clinical practice came from that workplace. So I'm really grateful for that. Yeah. But at the end, it got a bit, routine, and I wasn't really challenged. So that's why I went to that avenue. So anyways, I went to this workshop and said, well, you can apply for different masters and different. I was also thinking about doing another undergrad, because since it's difficult for in Australia to recognize other degrees, especially if it's in South America and Spanish. The standards are quite high. Yeah. So even though, like, my undergrad took 6 years, where any undergrad takes only 3 years. So, but anyways, I applied for a master's in research, and I got in contact with this supervisor, and he was happy to have me as a supervisor. Fantastic. Over there. So I said, well, let's get that avenue, but I didn't have $30,000 a year to pay for the fees. So I had to apply for a scholarship. So there was this scholarship called All Safe Scholarship, and I applied for it. And I just said, well, I'll apply for it. I'm not going to get it, but you got it. I got it. Absolutely fantastic. That's incredible. The level of competitiveness on those scholarships is it's phenomenal. So achieving that is great. I think it helped that I was already had a lot of experience in clinical practice, and because my undergrad was just standard. I wasn't like top student. I was just regular, but because of my postgraduate courses and all my training and all my work experience, I think that helped. And talking to the supervisor, he was happy with the projects that we were thinking about doing though. So what did you do for your masters? So there's like activity-based physical therapy. So it's basically exercise in a adapted gym for people with spinal cord injuries and stroke. So we wanted to see if the combination of what they were doing kind of muscle strength and aerobic exercise, and we were trying to kind of look at the outcomes to see if they really improve objectively. So I was looking at, we did a couple of tests, aerobic tests, muscle strength testing, and over a period of time I tested several people, and we just do a cross-sectional study. It was a very simple study because it was only a master's. So I did a systematic review on people's spinal cord injury, about the literature, what's going on, what do we know about a combination of this specific therapy, and what are the outcomes. And we found that the literature is very, very scarce, and it's because it's so difficult to do research in clinical populations. It's just incredibly challenging, and I found that with doing my PhD as well, that is, all the results that you get are very of low quality and very low numbers. Really? And it's so difficult to have very massive studies that
what made
include.
it so low quality? Was it like, I imagine you were measuring things like you said, you were looking at aerobic rates?
Yeah,
muscle
well,
density,
there's
stuff
several
like that.
factors. Like when you are trying to perform a physical exercise in people with spinal cord injury, so you have to think it's someone that below, depending on the level of injury, you have some deficit below the level of injury that really limits your capacity to exercise. So most of the people, they rely on their arms to do exercise. So if you go for a run, you basically get your heart rate up and you get all these great benefits of getting that blood pumping into your arteries and getting all this stimulus to your heart. That is great. But when you only have a limited amount of muscles to perform an activity, you're very limited, and that aerobic stimulus is not really there, and it's very hard to achieve. And there are also several medical conditions attached to every clinical condition, especially spinal cord injury, that really limits the ability of the people to perform exercise.
So I understand. So you can't really isolate a single case study. You have to go, we're looking at this injury, but every case we have, or every individual has
totally
their own
different
unique environment.
Like even if you have a level of injury, say a thoracic 10, and you have two people with the same level, the same age, the same both males, they will act totally different. They will perform, the response to exercise will be totally different. So that's why it's so difficult to standardize a specific exercise for this population, because it's a huge variability among the population that it's performing research in this area is extremely challenging.
So now taking all this on board, and you knew obviously that the research is very objective and isn't quite as smooth as it should be. Did you carry this research on into your PhD and take all this on board and, I suppose, start to improve?
Well, yeah. So when I started my PhD, I kind of tried to, based on my master's, I found out that muscle strength was a key element to train these people. So aerobic exercise wasn't quite the key in terms of getting the outcomes that will get them the health benefits that they need. So muscle strength seemed based on my studies and based on the literature, seems to be the key. So for my PhD, we use electrical stimulation to develop a muscle strength training program. So we can try to see if by improving muscle strength of the lower limbs, so if this is muscles that are partially or complete paralyzed. So because voluntarily, if you go to the gym, you have resistance and you build up muscle. These people that are unable to voluntarily contract the muscles below the level of injury, so on the legs. So we need an external assistance. So we're using electrical stimulation to use that muscle strength. But there are many problems with electrical stimulation because it's an artificial way of contracting the muscle, so it's not going to be the same as if you voluntarily contract the muscle. You will fatigue very quickly. You're not going to get the same benefits that you will get if you go to the gym and do the muscle strength training. So the idea was to develop some sort of different program in the electrical stimulation area that will kind of get close. No, I'm not saying it's going to be the same, but get close to what a voluntary contraction would look like and get the similar benefits that you will get if you go to the gym and do muscle strength training. So in a way, it was more applicable because at the clinic, everybody uses electrical stimulation. It's being used regularly, but what is lacking at the moment is what are the best parameters that we need to use to elicit the best muscle adaptation that will get all these benefits. And at the moment, the clinicians, this is where we have this gap between the clinicians and the research. Is clinicians kind of go with what they think is going to be the best, but they don't really look into it and really research what would be the best way according to that person. It has to be very individualized.
Yeah.
Because depending on the level of injury, depending how they respond to the electrical stim, you can adapt the parameters and get the best outcome. But at the moment, there are no guidelines. The guidelines are very basic and very general and doesn't really apply to a more individualized approach and getting the best outcome for each people.
So what parameters were you looking into to assess whether you had the right configuration, I suppose, for the electric?
Yeah, so one of the main things we were, because you can't really research everything.
Yeah.
That's what it's like. You can have 10 PhDs out of it, but you can only need to focus on one specific outcome. So we were looking at what we call the pulse width of the current of the electrical stim. So at the moment, what they use in the clinic is what we call a narrow pulse width, which means the electrical stimulation, when you apply into the muscles, you need to kind of reach a threshold, so you get an action potential, and then the muscle gets that excitation, contraction. So you get that muscle activity based on the electrical stimulation that is coming from an external point of view. Voluntarily, that electrical stim comes from your nerves, from the brain. But because we don't have that, we have to do it externally. So we were looking at doing, instead of a narrow pulse width, which if you're doing a narrow pulse width, you're only stimulating what we call the motor units.
Yeah.
So the motor units are the ones that are in the periphery. And the main problem with that is that they fatigue very quickly, because if you're stimulating repetitively the same motor units in the same time, at one point you're going to fatigue.
So it's not necessarily the muscle that fatigues quickly, it's the nerves.
It's just the nerves,
kind of
exactly.
activating the muscles.
Exactly.
Yeah.
But you have, if we have, especially an incomplete, what we call an incomplete spinal cord injury, an incomplete means that there's some remaining activation going through the spine, although it's not totally fully activating the muscle. There's some fibers that are going through there, and if we can activate those fibers, there's a concept of neuroplasticity that we talk about. Neuroplasticity. Okay. So this concept means that in the past, people in the rehabilitation settings will only focus on the muscles that are intact, so the muscles that are not damaged. Yeah. So if you're in a wheelchair, we'll train your arms, we'll train the way you transfer, we'll train everything, we adapt everything so you'll be independent and you can function in everyday life. This new concept of activating the muscles below the level of injury is based on this neuroplasticity concept, that if you start activating by different means, electrical stimulation, getting people to stand up, getting to walk, even if it's with what we call the exoskeletons, or if you're on the treadmill. So all these kind of stimulus that are coming, so if you stimulate the lower limbs, you kind of using those pathways that are kind of sleeping because they're not being used, and you can somehow, if there's still some connection, you can get more connections coming up and down from the brain, and you can use that to maybe in the future, if we have a cure for the spinal cord injury, of this it's stem cells or all this technology that is coming out, this exoskeleton, they're putting interface on your brain that will connect the brain to your spine. So it's all these crazy things that in the future it will work. They're still on the initial stages, but in the future it will work.
That's fantastic. So you're almost jump-starting really the neurosystem that's kind of damaged.
Exactly.
Kind of just giving that little bit of a kick, hoping something reinvigorates.
But if at the same time you kind of wait for that time, I mean, all these people have injuries. It could be 10 years ago, it could be 5 years ago, and all of this time they'll be sitting on a wheelchair. And if you're just sitting on a wheelchair, your muscles are gonna be totally destroyed, like totally damaged, with a lot of atrophy, a lot of intramuscular fat generates between the muscle. Your bones are gonna be extremely weak, and all of these physical health problems that you have because you're
wheelchair.
appears, and it will be extremely difficult for these people to use that technology in the future if you don't take care of the muscles and the bones and everything.
Okay,
you know what I mean?
So you're using it as a method not only to kind of encourage those pathways, you're using it as a, I suppose, maintenance method to ensure that people today can use the technology of tomorrow.
So it's not only a matter of, because people say, well, all this technology that you use, they're not going to make these people walk again. Well, we don't have that power at the moment, and it's kind of another area of research that at the moment is being developed. Mm-hmm. But being a physiotherapist, you can make sure that the musculoskeletal system is as healthy and strong as possible, so in the future they will be able to use that technology. And not only that, if you're generating muscle and you're getting the bone stronger, you are getting them a lot of physical health benefits that will prevent them with all of these medical secondary conditions that appears after spinal cord injury, because of the fact that they are sitting there on a wheelchair and they're not activating the system below the level of injury.
Yeah.
So it's kind of it's not only just one purpose. It's like thinking about more of a big picture, like
so the applications what you're looking into, and I assume many others are looking into at the time, has huge implications for the health and maintenance of people who have suffered spinal injuries when technology eventually catches itself up.
And at the moment, like I said, they're being used in electrical stimulation, they're being used in different technologies. There's one equipment that we call the FES bike, so it's functional electrical stimulation bike, and they use that so they stimulate the muscles in a way to perform a biking activity.
So the muscles will move autonomously with the electrotherapy going through it.
Exactly.
That's really interesting.
So they use,
really cool.
Yeah, they use that, and we also have like a cross trainer with the same concept. We have electrical stimulation on the legs, and people are on a machine and they're doing this cross training.
They're just external probes.
It's external,
to the central nervous points on the legs.
Exactly. So peripherally, they are activating the muscles via an external stimulus, but at the same time, when they do these activities, we ask the person to really concentrate on what they're doing and kind of connect the activity on with the central nervous system. So there's studies that shows that if you are actively thinking about moving your leg, you're activating one part of the brain that really controls that movement of the leg. So it's kind of trying to stimulate from different points of view, like different areas, and kind of bombard the system with a lot of stimulus, so it somehow will generate a response. Because if you let, like at the moment, if you have a spinal cord injury, you develop spasticity, for example, which are spasms in the muscles that are very, very strong, and sometimes make people difficult to transfer from the wheelchair to the chair, or difficulties in activities of daily living. What they do, they give them baclofen, which is a drug that will kind of suppress that activity of the spasticity. So they suppress the central nervous system, that connection. And all of the medicine at the moment is kind of, let's just suppress this, don't touch this, let's just keep everything. So
kind of isolate it all.
Isolate.
That part's gone, let's just
because if we do something, it may, there's a lot of fear of what would happen, because there's the unknown of if we stimulate here, what could happen. Like it may trigger something that we don't want to have. So that's why the clinicians are very conservative, and there are avenues that you can explore that if you take the precautions and you do it, in a very controlled way, you can still get benefits. But of course, that's why research comes into play, so the clinicians can be safe to use that technology.
Did you have any subjects say they felt anything weird or sensations kind of returned when they were doing
so they were, I only had, so I did 3 different studies, so I'll explain kind of the process. What we did first, we did in healthy people.
Yep.
So the idea was to get all the feedback from this type of stimulation in healthy people that are able to tell me if there's really painful, if there's very uncomfortable, and things that maybe someone with spinal cord injury won't be able to tell me because this lack of sensory activation. So we performed that in healthy. We found that it was safe enough to use it in spinal cord injury, and the second study we performed in spinal cord injury. And on the third study, we apply that steam in a 12-week intervention study.
Okay.
So we did a couple of tests before the training. We trained them twice a week for 12 weeks, and then after we performed the same assessments that we did at the beginning.
Yep.
And interestingly, during the training, people will just be really amazed about the fact that first that they could see that strong muscle contraction, because usually when we're using electrical steam is quite low intensity, but this is quite strong, and it's visibly you can see the muscle contracting.
Is it a level that would hurt someone with full sensors?
No, that's why we try it in people with individuals, in healthy individuals. It wouldn't hurt, but it's noticeably, you can see that strong contraction, and they were fascinated by the fact that it's like being back in the gym and I'm exercising my muscles, and that psychologically is just, it's great.
You
because
still get the electrochemical and neurotransmitter release of
dopamine.
Exactly.
So it just, they were fascinated by that. And the other thing is that most of them will tell me, I'm feeling something. So they were feeling things that they haven't felt before. So it means that sensory speaking, they were getting some sort of activation that they wouldn't get otherwise. So I'm not saying this is the best approach. It's just one approach, and there's still a lot of things that we need to be done. And this is just one parameter that we change.
Yeah.
And there are many other things that we have to consider. But I think exploring different avenues and getting them to do a muscle strength training, use electrical stimulation. That's the main key. Doing muscle strength training, not just doing a little bit of steam just to perform an activity and keep it safe. So in case something happens, because we try on these people and they love it. We didn't have any problems. It didn't elicit spasticity. If anything, it will with the sessions it will decrease the spasticity. So they were feeling much better, and the main outcome that we found is that the muscle mass increased significantly after
Fantastic.
12 weeks. So one of the guys said that he had to buy new shorts because he couldn't fit in the shorts. So that's amazing. Even if it's not muscle that they can actively use for everyday activities, it's still a muscle mass. They're releasing, if you have a big muscle mass, you are releasing a lot of hormones and anti-inflammatory markers that will help you prevent secondary complications such as cardiovascular diseases, or your arteries are cleaner, your cholesterol level goes down. So you kind of preventing this cardiovascular risk and all these other complications that you get after a spinal cord injury.
And then on those, I suppose you've also got the mental health benefits.
Exactly.
Of them being able to actively exercise again. So do you think, can you see in the future this technology with fine detailing, I'm sure, being not necessarily used in commercial public gyms, but being used in specialist
I think so.
physio-controlled rehab centers?
I think so. I think that's where we're trying to head into, and that's one of the reasons I'm in the area. I'm just trying to bring evidence so clinicians will be more aware of what are the options and apply them and get the best ones for. Like I said, this has to be individualized. You have to really assess each person, and it takes time. Yeah. And that's why sometimes
people, anything that involves people and their health is a long-winded study. Like you need to not just to look at the short-term benefits, you need to look at the benefits 5-10 years down the line. Are they still benefiting from this treatment?
Exactly. So it's such a long way, but it's worth giving it a go and exploring those avenues. And if you're a clinician, just go and read the articles, because there's a lot out there, and there's a lot of research in that area, and you can learn a lot by just reading the articles and seeing what is out there, what is different, what are the outcomes, what do they found. And based on that, you can make your decision, okay, what is the best option for this person? How can I make the time that they come to the clinic, how can I make that very effective and, useful for them in the future?
After the show, do you mind emailing me some of the articles? And
when
I
of
release
course.
this, I'll put them in the caption, because I know a lot of people that will probably be very interested in my direct friend group, letting the listeners.
Yeah.
Did you happen to find there were any severe limitations financially, apart from your migration purpose coming over, which I'm sure had its own bucket list? But financial limitations, ethical limitations, or anything like that?
There's a lot of limitations when it comes to research, but one of the main things is getting people to commit to come and exercise for 12 weeks. I started with 7 people and I have 2 dropouts, and because it takes a long time, they have to really there's a lot of time commitment for them. That's kind of a limitation in terms of getting access to people with spinal cord injuries. I kind of advertise it everywhere I could. I put it. I went on every single Facebook page with.
You said you had 7 people and then 2 dropped out during the experiment. With research, statistically, for most things to be significant, they go on about sample sizes.
Yes.
They have to be significantly large.
I know.
How does that work with 7 people?
Well, that's the main problem, and you have to consider when we're talking about being significant. So this is where the part where the academia doesn't really match the clinicians, because if you're looking for a significant difference, you need first big samples. But at the same time, if you have big samples, you're going to have a huge variability.
Yeah.
So your outcomes are going to be incredible all over the place. So you're never going to find statistical significance. So that's the main problem. And that's why the research articles are really low quality, because we cannot reach that huge amounts. There's one big study that they're still analyzing the results, called the SCIA, Spinal Cord Injury Physical Activities. SCIA, and it's one of the randomized controlled trial that has been going on for at least 4 years now, and it's been going on in Australia and New Zealand. So they have big numbers and they have a lot of outcomes, and let's see what they found. But I'm sensing from what I'm seeing is that it's really hard to find any statistical significance, even with big numbers, because, like I said, you have a huge variability. You have
humans are very dynamic. Their environments, their bodies, their personality, and all of that together is never going to be able to. You're never going to be able to isolate the parameters in bounds you don't want.
So, as a clinician, what do you do? Because you find this as there's no statistical significance, so I shouldn't use it. But maybe that type of training could be the perfect type of training for your participant, for your client, if has the same characteristics. If you try a different test and you see, you have to do a little bit of investigate on that person and see, okay, what would be the best option for this person in terms of their goals,
So as a physio, you tend to, when you're looking at I suppose unique injuries, or like a generic injury but it's going to have a unique solution, you kind of shortlist a bunch of treatments and you're going to just go, let's work our way through this roster and see if any have a significant impact upon you.
Exactly. And that's also a problem in terms of what the client's goals and expectations are when they come to a clinic and they're working in a physiotherapy program, because sometimes they just come and say, well, I want to walk again, and it's
like that. Please.
My main goal is walk again. Okay, so can we work on maybe small goals so we can work towards that main goal? So
start by wiggling your toes, maybe.
Exactly. So sometimes you have to be more realistic and kind of offer the person realistic goals and what you want to achieve. Do you want to? Sometimes the main problems in people with spinal cord injuries, they have bladder infections. And it has
Really?
been, and it's a massive thing, because when they have in a urinary tract infection, it affects everything. They have more spasticity. When they exercise, you have to have a lot of precautions. There's a lot of things that they need to be aware when they're exercising that really limits their ability to exercise if they have a urinary tract infection. So if you can avoid or get less frequent urinary tract
UTIs.
infections, you can get
So
a
why
better
is
outcome.
that? Why do they, I mean, as short answered as possible, why are they more susceptible to UTIs?
Because there's the urinary tract system so basically below the level of injury is not only the skeletal muscles that don't function, it's all of the other muscles inside that controls your reproductive and urinary tract system. So
I never thought about it.
yeah,
like that.
and then they need, most of them, they need to have they can't go to the bathroom like we normally do. They can, because they don't have the contraction to
squeeze, I suppose.
just to void. Yeah. So they need to use catheters. So they use a catheter and they have self-catheterize. So they have to time it every 1 hour, every 2 hours. They have to do the self-catheterization.
That's a lifestyle
I know.
factor that I never even thought about. I
Yeah.
just thought, okay, you're in a wheelchair, you can't walk, sorry. That must be a pain in the ass for X, Y, and Z, but I never thought about...
There's so many other complications that people don't know, and they are as important as walking. So it has been proved that using electrical stimulation and getting this activation of the lower limbs, standing, actively thinking about moving and doing maybe treadmill what we use a treadmill and people moving the legs for them, but they're actively thinking about walking while they're doing that. So all these activities is really stimulating the system that is kind of being shut down.
It's almost like a phantom movement.
Exactly.
Like you are making yourself think you're doing it and your body's doing it, but that kind of bridge connection is still not working.
Exactly. It's just try to think as you have a bridge that has been cut.
Yeah.
Right? So if you just leave it there and you open the gap more and more and more and more, it's never gonna get together. You can never get from one point to the other.
Yeah.
It's gonna get farther apart more and more and more. But if you kind of push in from this side and push in from the other side, somehow it's just physics. It's just trying to push the two things together. At one point, if there's kind of a magic connection that comes at one point and you're always stimulating both sides, it will be much easier to get that connection back again than if you just but if you leave it like that, it will just, if you don't use it, it won't work.
So that's almost a very important message there of if you have suffered an injury, rest is important, but don't get lazy.
Exactly. Well, the main research is telling us that the earlier you get exercise after an injury, the best outcomes you get. The first 6 months of the injury are the key.
Yeah.
The more you stimulate in that period of time, the best outcomes you get. They're even using electrical steam bikes while you're in the hospital, even like laying down. They just you can just put your legs in the air with a special equipment and just do biking.
Hospitals are so boring. Why would you not do that? Like,
exactly.
That's something to do.
Exactly. So there's a lot of things that the research is there. There's proof that works, but they haven't implemented it yet.
Yeah.
You know, and there's just small things that you can do that could make a huge difference in the outcome. So if they start doing electrical steam from day one, if they start standing up from day one, if they just perform activities that will kind of stimulate the lower limbs from day one, chances are that whatever reconnection is still there, if you keep that active, it will somehow reconnect and you'll get much better outcomes than if you just leave it there and just lay down, be in a wheelchair and do nothing. So that's kind of the main message. Just get out there and be active. Of course, you're going to have limitations, but just find ways so you can get that stimulus going and keep
active.
Keep active, exactly.
and eat healthy too.
Exactly. Yeah, it's all a combo. It's not
combo.
just physical activity. You have also nutrition and looking after your health and drinking.
Exactly. Responsibly.
Yeah,
Straight
exactly.
after the Christmas period, I'm sure many people have jumped on that bandwagon. I think we'll finish it there.
Okay.
But thank you very much for coming on the show. It's
No
been great to
worries.
have you, and I've definitely learned a lot from that.
Okay, awesome. Thank you.
That was Vanesa. Thank you very much, everyone, and thank you, Vanesa, for coming on the show. It was a delight to talk to you. If you happen to have any questions for Vanesa, then please contact us at vaguecomments@gmail.com, and I'll forward them on, or elsewise I'll answer them if I'm able to. If you haven't checked out any of our social media platforms yet, you should definitely do that. It's the best way to keep in touch with us and find out what's going on. We also share the articles that we find out there that are interesting. So we're discovering the science for you. As always, if you have any questions, please contact us and I'll forward them on at vaguecomments@gmail.com. Or if you yourself wish to feature on a few upcoming episodes and talk about your research, we encourage you to contact us. We're always happy to meet new people. But that should be it for us this time. I hope you enjoyed the show and look forward to hearing from you soon. Take care. Bye.